Hello, everyone. Welcome. Thank you all for being here. We're going to get started in a minute or so just hold tight and we'll get going shortly. Hello, everyone. Welcome. Thank you so much for being here. We're just going to give it like one more minute and then we'll get started. Hello, everyone. Welcome and thanks so much for joining today. We're going to get started now. My name is Yona Zeitz. I'm the Advocacy Director of the Katal Center for Equity, Health, and Justice, and I'm one of the co-authors of the Mental Health and Rikers report with the Data Collaborative for Justice at John Jay. Katal is a grassroots organization focused on developing intergenerational leadership and organizing capacity to build community-based power and win systemic change for equity, health, and justice. This year marks the 10-year anniversary of our launch, and our founding campaign was the campaign to close Rikers. We've worked over the last decade to get the city to commit to closing Rikers, and we've advanced state-level reforms like bail reform and the less is more parole reform to reduce the city's jail population and make closure possible. However, over the last 4 years, due to the previous administration's jail-first approach to public safety, we've seen a drastic increase in the city's jail population. In particular, there's been a ballooning subpopulation of people with mental health needs, which now makes up around 60% of the city's jail population. 22% are diagnosed with a serious mental illness. Rikers is no place for delivering proper care. It makes conditions worse and can be deadly, as nearly 50 people died in city jails under the previous administration. Rikers now functions as the largest mental health facility in New York City and one of the largest in the nation. As New York City works towards its mandate to close Rikers under a new mayoral administration, addressing the mental health needs of people in the jail system remains both a defining challenge and a critical opportunity for reform and to advance closure. The goals of the report we will be discussing today are to present the latest data about mental health needs in New York City jails, reveal powerful case studies about the directly impacted people behind these facts and stories, and identify a continuum of safe and effective diversion strategies. It includes a 12-point plan to create a more effective and humane path to reduce the jail population and shut down Rikers. And so during the webinar, please submit questions by clicking on the Q&A button on the bottom of your Zoom screen. We'll also share the link to the report we'll be diving into in the chat. And lastly, please make sure to save the link to the web event page as we'll post the event recording, the PowerPoint, and other important resources for you all. And so now I'm going to pass it over to Mike from the Data Collaborative for Justice. Mike, the floor is yours.
Yona, thank you so much. My name is Mike Rempel, Executive Director of the Data Collaborative for Justice. Welcome to the webinar. The Data Collaborative, or DCJ, is a research and policy center that works on three main topics: mass incarceration, racial disparities throughout the legal system, and low-level enforcement. Much of our work in the first area, that's mass incarceration, has focused on identifying data-driven strategies to both safely and substantially reduce New York City's jail population and close the jails on Rikers. Obviously, for that reason, we were delighted to work with the Katal Center and delighted they invited us to join this project. That's about it by way of introduction. As we do with all of our work, we start with the data, and so I'm going to turn it right over to my colleague, Kellyanne Bach, for that.
Thank you so much for that introduction, Mike, and thank you to everyone for joining us today. Like Mike said, my hope is to orient everyone on the data behind this report and to give some updated facts on the needs of individuals incarcerated in New York City jails. So as of yesterday, Wednesday, January 14th, 2026, 6,824 people are currently incarcerated in New York City jails. And as you can see here, we included a bit of a breakdown just to give some further insight as to why people are incarcerated in these jails. Like Yona mentioned earlier in his introduction, there's a troubling ballooning subpopulations of individuals with mental health needs. 60% of individuals have flagged for the mental health needs, and 22% of people have a official diagnostic of a serious mental illness. I just want to pause quickly to provide a little bit more context on what a flag means in this context. Its DOC has what they call a broad H flag, which is supposed to be an identifier if someone has requested, been screened for, or has received mental health services. And the term broad H comes from a settlement with the city that requires anyone who's been identified for needing some support for their mental health needs to be met with discharge planning. And this is something that Mike will touch on a little bit later on with his policy recommendations. So as you can see at this line graph here, the subpopulation of individuals with mental health needs has been increasing over time. And I also just want to quickly highlight that 200 individuals are being held at Rikers for mental competency proceedings. When we dive a little deeper into looking at this subpopulation with mental health needs, we see some important characteristics that I'm going to pull out for you. We see that women flag at a higher rate than men. And then although race differences are small, because Black people make up 58% of the population and 61% of them flag, there's some concerning disproportionality occurring. Further along those lines, we also see that individuals with mental health needs spend a disproportionate amount of time in custody in comparison to those who do not. Unfortunately, mental health needs are not the only needs for individuals in New York City jails. Correctional Health Services has identified that there are physical health needs for these individuals, such as substance abuse health needs, chronic medical health needs, and they also have identified that 28% of the population in September 2025 has identified that they are homeless or will be homeless upon discharge. And it's important to note that this percentage jumps up when you take into account a serious mental illness diagnostic. Of important note, while we were taking this physical health concerns into account, Department of Corrections also publishes that there is a high rate of medical no-shows, which means that individuals are not making their medical appointments. And the reason outlined for that was production refusal as the highest recorded reason. It is important to note that some individuals have reported being unaware of an appointment, but this is what the data represents. Unfortunately, there's also high rates of exposure to violence. When we dig deep into this and when we compare it to August 2019 to August 2025, we see that monthly stabbings and slashings have increased. Fights among incarcerated people have also increased, but assaults on staff have declined. And similarly to this decline on assaults on staff, we see that use of force rates has also declined. I'm going to go ahead and I'm going to pass this back over to Mike, and he's going to walk you all through our policy recommendations. Thank you.
Okay, thank you so much, Kellyanne. So just to give a sense of the next 12 or 13 minutes, we're going to start very big picture beyond this report. Then we're going to zoom in to this report, talk a little bit about mental health service investments, a little bit about mental competency proceedings and how to avoid incarceration for those individuals, a little bit about implementation, and then we're going to move forward and turn it over to our next speaker, Tracy Barber, to talk about her experience. So this is zooming out to the very big picture, reducing the jail population from its current total of around 6,800 to 4,200 or less, which is the number that represents the maximum daily capacity if we successfully close Rikers. The takeaway from this slide is that there's not one or two or four key areas of policy reform that can reduce the jail population sufficiently. But what I've tried to outline are 6 areas with about a dozen strategies per area where we can start to make a cumulative impact. And briefly, those areas that you see on the slide are, number 1, the city using its legal authority to release people early from jail sentences of less than a year. But remember, only 8% of the jail population is serving a sentence, while over 85% are held pre-trial. So that leads to the rest of the list. Second is partnering with the court system to set bail less often, especially in the proven large fraction of cases with little risk of skipping their court dates. Third is implementing so-called second look policies to take another bite at the apple and review the cases of detained individuals to see if they might be safely released to services. Next is implementing best practice case processing reforms to reduce the length of stay for people who cannot release from jail during the pre-trial period. And then finally, and I'm going to argue most importantly, fifth is implementation. That's essentially making all of the above strategies more effective through trainings, bench cards, assessments, protocols, and case management, things like that. Now, this report is about the last category that I'm finally getting to, which is spending money and investing in treatment and services. And you can see the rectangle, especially in the areas of housing and mental health, which is what we're focusing on in this report. So let's go to the next slide. Yeah. So we're still at the big picture, not the small picture. Big picture. What we wanted to do in this report, and you can read the details in it, so I'm not going through everything, is to both synthesize what's already been written and expand on it. So the slide gives 2 examples of reports we drew a lot from. We have 15 recommendations. They're divided into 5 categories. I'm going to start by placing a giant purple circle around one of those categories, and that is D, implementation. We had a philosophy going into this report, and that philosophy is that we can spend money and we can make investments, but that a build it and they will come approach is flawed. In other words, we can't just build mental health services in the community and assume that judges will send those people to the services, or that people will magically appear at those services without case managers at courts and jails to bring them into them. So by way of philosophy, in some ways, what we see is, I guess, our most original, or at least our most accentuated contribution in scenario D. Okay, now we're going to zoom a little bit to the small picture. So let's go to the next slide. So this is the first of the 5 major areas. A, continuum of mental health, diversion, and housing investments. You can see them on the slide. They're organized at the top from most restrictive, as in residential options, to least restrictive, as in outpatient options. So starting at the top, people with co-occurring disorders. We know from Kellyanne that 22% of people at Rikers have a serious mental illness. 25% have an opioid disorder. 30% have an alcohol disorder. So inevitably, these kinds of percentages make clear that there is a substantial population with co-occurring mental health and drug disorders, yet we currently only have one dedicated residential facility, and you can see it on the slide, it's Harbor House in the Bronx, with a limited number of beds for this population. So that's the first area of investment. Okay, down the list. JISH housing. That just basically means housing, supportive housing with services for justice-involved individuals. Around 500-ish beds have already been approved and funded, but they are mostly not online or available. So we both need these beds to come online and to approve more of them so that we have a place that's dedicated for justice-involved people to get them out of Rikers. Moving on down the line, you can see we discussed temporary emergency housing, intensive case management models for people who do have housing, but otherwise have high service needs, on down to outpatient treatment. Okay, let's move to the next slide. Okay, mental competency proceedings. I'm going to stay on the slide for a couple minutes. So the purpose of a mental competency proceeding is to determine if someone can understand the court process and assist in their own defense. And there are 3 stages. And for the most part, people sit at Rikers currently in all 3 of these stages. Clear public data doesn't exist, but from what's been reported, it appears that over 200 people are in Rikers, and some estimates are closer to 300 with pending mental competency proceedings. So let's go through these 3 stages and how come they're at Rikers and what else we could do. So the first is a judge has agreed to order a competency assessment. And so then typically people sit at Rikers for an average of about 40 days. The law does not require them to be at Rikers. They could be in services in the community. So that's the first step, is to make Rikers not necessarily automatic at this stage, but also to provide case management resources to help people appear for their competency exam and appear for their court dates during this first stage. The second stage, someone has been found unfit to stand trial. At this point, they then typically sit at Rikers for an average of about 80 days while waiting a placement in a state forensic hospital. Now, again, they don't have to wait this 80 days, and they don't have to even go to a state hospital by law. But it's a little more complicated because the district attorney by law must approve an alternative to a state hospital. So again, what we propose are basically investing in dedicated restoration services that are suitable for people in competency proceedings, both inpatient and outpatient hospitals, as an alternative to state hospitals, and then working with DAs to establish criteria for who might be appropriate for these community-based services in lieu of our status quo of sitting at Rikers and then going to a hospital. Finally, someone receives treatment in a hospital or in the community, and they're restored to competency. They're found fit, but they may still have mental health needs. Again, while the case is finally adjudicated, they will often sit at Rikers. An example we point to is the Brooklyn Mental Health Court, where at its founding, once someone was ultimately found fit, they were immediately restored to the mental health court and assessed for participation as an alternative to incarceration. And we propose making this an automatic, formalized citywide policy to let mental health courts at least screen people restored to competency. Okay, so that's this topic. All right, let's go to the next. Yeah. Okay, I'm just touching on it. This is Area C. 2 speakers later, we'll have someone who will talk more in depth, Stephanie, on mental health courts. So I'm just flagging this as a content area, but let's move forward. And we'll come back to this later. Again, we put a giant purple circle around implementation because we don't believe that merely spending money on the problem or merely taking we'll build it and they will come approach works. So we try to spend a lot of space sort of thinking through how we can get good implementation and be able to place people in treatment facilities that we create. And we came up with what's on the slide. So this is recommendation 11 in the report, is basically meeting with the court players regularly, providing updates on the data, updates on prevalence of mental illness and conditions at Rikers Island. Next, doing judicial trainings with judges, prosecutors, defense attorneys on the available community-based treatment and housing options that we built. Next, hiring case managers who are available at courthouses and jails to ensure seamless coordination such that they can assess people and place people in available treatment slots, and then have those treatment slots held while they inform the court and have the judge actually agree to put them into that slot, remembering that it's ultimately a judge's order that gets people out of jail and into treatment. And then finally, this connects with the previous recommendation. We recommend having the capacity to do individualized assessments, both at the court or after someone has been incarcerated. Okay, next slide. And this is the fifth area. Hospital-based secure therapeutic beds are a tool that is already in the plan to close Rikers Island. And what they are is just what it sounds like. They're therapeutic beds. They're in off-jail hospitals. There are 3 of them around the city. And the close Rikers plan involves building about 350 of these beds. Now, as you see on the slide, this is not a true alternative to incarceration in the sense that the current plan involves correction officers staffing the off-jail hospital beds. So these are secure beds, corrections are involved. So at least in this report, we make the argument not that we should massively expand these things as opposed to all of the previous things in the report, but that we should study what the need is. How many people would be sitting at Rikers, even if we did all the other things in this report, if we did not have these beds, and then consider whether we should add more than 350 of them as planned, although we certainly embrace implementing and putting online the 350 that have been promised that are not yet online. Okay, next slide. Yeah, so we were delighted that in this report, we could include 4 lengthy in-person accounts, every one of which illustrate through people's direct experiences, the very problems, and also some of the solutions for people who are stuck on Rikers Island with mental health needs. I think I'm doing okay on time, so I'm gonna read what's on this first slide, and then I'm gonna turn it over to Tracy Barber to talk about her experience. So this is Danielle Shanks. She's a member of the Katal Center. She talks about her son. She says, my son, who has a severe mental illness, is currently being detained at Rikers Island. Recently, he has been advocating for access to outdoor recreation, which for no apparent reason was being restricted. All of these conditions only exacerbate his mental illness and prevent him from reaching his fullest potential. Words cannot explain how terrible Rikers Island is. It fails to keep people safe and harms human lives. In the first year that my son was detained at Rikers, a judge in the mental health court found my son unfit, and since then we've been waiting for him to be released to receive treatment within the community. Recently, the DA denied my son access to programs, and there's currently no avenue for him to get released and receive the treatment he needs. At least as of when we released our report, Danielle's son was still at Rikers. So besides the powerful nature of this kind of account, and this is just an excerpt on the slide, it illustrates some of the content of the report. Danielle talks about the poor conditions at Rikers, and then her son's case is precisely a case of being stuck in Rikers during mental competency proceedings, one of the 5 areas addressed in our report. So now I want to turn it directly over to Tracy Barber to tell her story, which also is going to illustrate some of the content of the report. Tracy, please take it from here.
Hi, everyone. My name is Tracy Barber. I'm currently an administrative assistant for a nonprofit in Manhattan serving adults with a mental health diagnosis. I love this occupation because it's a way to help people stay out of the hospital and stay out of the situation like the one I was in 2019, when I was detained at Rikers Island for a period of 10 months before being released into the care of the organization Cases and Mental Health Court in Manhattan. Before and post-arrest, I was suffering a mental health crisis and had been having difficulty in the community obtaining the antipsychotic medication that I needed. I was also in a new relationship with someone who turned out to be seeing someone else, and I felt devastated at the time. Unfortunately, while intoxicated, I had an incident with a neighbor related to the dysfunctional relationship where I caused injury and was arrested. That day, prior to the incident and arrest, I tried calling NYC Well, and the counselor told me that he wasn't a therapist and hung up on me. Post-detainment, I decompensated further and was poorly assessed at Rikers and was not given the medication I had struggled to obtain steadily in the community that worked best for me, that fully medicated my symptoms, and had a mental breakdown in which I stopped eating and eventually began, for the first time in my life, hearing voices. I was admitted to the jail psychiatric ward of East Elmhurst Hospital, where I finally received medications that worked and within a therapeutic setting, and also after being admitted to a medical floor while handcuffed to a hospital bed, they were able to induce me to eat. The nutrition at the hospital was so much better than Rikers Island, where vegetarians are only given a cold, unseasoned container of beans each day to supplement their diet. Once I was stabilized and released back to Rikers, I became a productive member of the jail, participating in the horticulture program and serving meals to the women in my unit. Eventually, I was introduced to a case manager from Cases, Kelly Whitfield, and mental health lawyer and Manhattan public defender, Catherine Bayuk. I passed the mental status exam, or the psychological test, I'm not sure what the term for it was, and was miraculously admitted into mental health court. People are rarely admitted into mental health court with a violent felony charge, and by the grace of the court, I was able to adhere to treatment and check in regularly with the court for a period of over a year, gradually graduating each level of court rather than doing 1 to 7 years upstate, hours away from anyone I know or love. But if I had gotten a maximum sentence, I feel my life would have been destroyed. Quote, "Bars can't build better men, and misery can only break what goodness remains," Stuart Turton. And I think I might have become suicidal, having had a suicide attempt many years prior. I would have lost supportive housing where I lived for almost 20 years. I would be a felon and struggle to obtain work in the human services industry that I love so much. Now, in addition to working professionally in a close proximity to supporting my peers, those with a mental health diagnosis, and being a long-term operations volunteer at a New York City charity, I am also a proponent of the Treatment Expansion Act, and I want others whose life circumstances and mental health have led them to feel lost to have the same opportunity that I had, to turn my life around and learn to thrive in a society with support. In the words of Nelson Mandela, who knew all too well himself the effects of incarceration, prison is designed to break one's spirit and destroy one's resolve. To do this, the authorities attempt to exploit every weakness, demolish every initiative, negate all signs of individuality, all with the idea of stamping out that spark that makes each of us human and each of us who we are. I will always be grateful to Cases, Catherine Bayuk, an angelic defender, and His Honor Judge Juan Marchand in the Supreme Court of Manhattan, and the District Attorney for giving my case a chance, and for their mercy, and for making the most substantial positive impact of anyone in my adult life. Mental health court helps individuals with mentorship and resources in the community. And if you ask me, that's where real change can happen. We have to decide as a society if we want to punitively and systematically break individuals, also noting that it costs nearly $500,000 per year to house an individual at Rikers Island, or give them the resources, the guidance, and the opportunity to establish themselves in ways they might not have been able to without the court's assistance and guidance, or without the amazing people like those I work with every day in social services. Angela Davis said, "Prisons do not disappear social problems. They disappear human beings. Homelessness, unemployment, drug addiction, mental illness, and illiteracy are only a few of the problems that disappear from public view when human beings contending with them are relegated to cages." To me, mental health court and other treatment courts are a beacon of light in the judicial system, and I am advocating not only to allow some individuals with higher level charges the opportunity to prove they can heal given the right opportunity and support, but also that mental health court be made available across our great state because, quote, "When we only have carceral solutions to social problems, there is very little room for actual justice, much less healing." Thank you.
Thank you so much, Tracy. And it's such a powerful testament to the Treatment Court Expansion Act and you spoke to the benefits in a way that I never could ever articulate, but I will give some background on what the Treatment Court Expansion Act is, and how people can become involved in the campaign. So obviously there's a mental health crisis in our state, in our country, and our default response is to warehouse people in prisons and in jails. And part of this comes from a history of deinstitutionalization that we have in this country, where the idea was that we had these very abusive psychiatric institutions that were going on, and we were going to go to a community-based model that just was never built. And so what we are striving towards now is what Mike was describing in incredible detail, which is all these systems of continuum of care that need to be built so desperately. Um, and we have now rising mental health issues that are happening behind the walls, and prisons are inherently not a therapeutic setting. So in 2009, drug law reform came about because there was rising instances of substance use disorder. There was a recognition that there was a sort of racist way in which this was being dealt with. And there was also some recognition that we needed a more efficient criminal legal system. So drug courts were established all around the 62 counties in New York State, but you could not have comorbidities of any kind of mental health issue to be admitted in these courts, which was a very strange setup. Obviously, when we think about mental health, obviously we think about someone presenting multiple issues at the same time. So the Treatment Court Expansion Act would modernize this. They would recognize the whole person, and expanding this existing state law. Ad hoc mental health courts have begun to sprung up throughout the state. That's why people like Tracy have been able to be admitted to mental health court, because they do exist. However, they can be very different across different boroughs. So Tracy mentioned having a violent fence and being able to be admitted. That's because some district attorneys allow that, but others don't. So just based on where you are geographically in a particular county, you can be admitted, but you may not be able to. And that's just fundamentally wrong. And it means that someone's entire trajectory of their life can change based on where they are. And so we need to change the law to recognize this fundamental injustice. And that will end the revolving door of incarceration, because we can address the root cause of criminal legal involvement, and people can stop being decompensating while incarcerated, and can instead be seeking treatment. So Treatment Court Expansion Act would change charge-based eligibility restrictions so that it wouldn't be that it's based on your charge that you would just automatically be discounted for inclusion in consideration for treatment courts. The district attorney would not necessarily have veto power. What happens is the judge would look at whether your qualifying diagnosis is connected to the particular crime you've committed. There would also be a pre-plea, which is getting a little bit into the weeds, but it's important in this particular moment in time, because you're required to plead guilty, which is a huge immigration concern, because if you have to plead guilty, that's presents an enormous obstacle for people who have immigration issues. And also, if you have to plead guilty to the top crime, you're exposed to mandatory minimum sentencing, which is a very scary prospect. So a lot of people choose not to participate in drug court. Treatment Court Expansion Act also curbs a lot of abusive practices, instead providing people with due process who are considered to be in non-compliance. And also the craziest thing that we had to address is right now, judges and prosecutors are the people making people's treatment plan decisions, which is Kafkaesque in nature. So instead, we would have clinicians making those determinations. So diversion helps decarcerate, makes the population smaller, which is what we're striving towards with Rikers here. We need to get people off the island. It leads to healthier, happier communities. It reduces recidivism by 50%. And so it made it through the State Senate Alcoholism and Substance Use Disorder Committee, into the Senate Finance Committee last year. It made it into Assembly Ways and Means, which is its own version of finance. And it hasn't, the governor didn't mention anything really public safety related in the state of the state. You could make an argument that she did. We don't know if it's better not to be spoken about at all, but we're, hoping that this is the year that it can be pushed in the budget. And so we have a advocacy day on January 20th to advocate for the Treatment Court Expansion Act. We have a bunch of community members coming up with us, people with all types of relationship to this bill, a lot of new people who've never ever participated in the advocacy day. Katal does amazing advocacy days, and they're a huge inspiration to us in terms of the work that they've done. And we are honored to have them as a partner at New York Community Defender Services. And so yes, we are going up on January 20th, and we invite all of you to come up with us and people like Tracy, who are in the wonderful Treatment Court Expansion Act Coalition, and meet people who are directly impacted, meet people who are attorneys in this work, meet people who are clinicians in this work, and to fight so that we can have treatment courts all across New York State.
Yes. Thank you so much, Stephanie. Good afternoon, everyone. My name is Melanie Dominguez. I am the organizing director at the Katal Center for Equity, Health, and Justice. And today I am going to be guiding us through the Q&A section of this webinar. And so I do want to thank all of our speakers for grounding us in the key findings of this report. And I also want to uplift all of the comments of love and appreciation that folks left in the chat for Tracy. We really appreciate you, Tracy, for being here and sharing your story. And with that being said, I do want to give a kind reminder that if you would like to ask a question, you can submit your question by clicking on the Q&A button that's at the bottom of your Zoom screen. And we do have a lot of questions to get through. So we had folks drop questions in the chat through the Q&A function, and we had folks submit questions in advance when they registered. And so we're going to try our best to get through all of them. And we ask that you give us some grace. If for some reason we're not able to get through all of them, we will be providing contact information for some of the folks on the panel that you can reach out to get your questions answered. And with that being said, I'm going to move in with our first question that was dropped in the chat and is asking, could you provide a little clarity on which diagnoses are included in the definition of SMI?
Yes, I can hop in and answer that question. Thank you so much for asking. The serious mental illness diagnosis has to be diagnosed by a mental health professional, and it can include a diagnosis such as schizophrenia, bipolar, severe depression, and anxiety. And these diagnoses tend to have significant long-term impairment on individuals.
Thank you, Kellyanne. And then the next question is addressed to Mike, and they're asking, can you expand upon the implementation focus area and possible strategies?
Yeah, so I tried to give a starter in the latter part of the presentation, but I can kind of circle back. So again, imagine that when we're talking about the data Kellyanne presented with 60% of the population in Rikers flagging for mental health needs, 22% with a mental health diagnosis, clearly a lot of those people can be better served in the community. So then the early part of our report outlines a series of investments where there are either some services but not enough of them, or there are services that don't exist. So essentially, the early part of our report is sort of about spending money and investing in new things. So, okay, so then imagine that those things exist, and then somebody is in court, and the defense attorney raises, an objection or makes an argument basically that they should receive supervised release with services or some such pretrial option. Okay, so then immediately, without having established protocols in advance to immediately make a swift connection, for instance, to just housing or to an appropriate placement. What's basically going to happen is what happens in the status quo with existing alternative to incarceration programs, where the judge is probably going to send someone to Rikers, and then they'll sit there until a treatment placement is established. And then sometimes what even happens is in the status quo, there could be a delay, the treatment slot could be identified if it exists, and then there could be a delay in literally having a judge then make the order, okay, now I'm releasing an individual to these community-based services. And then by the time the judge releases them, then again, the treatment slot no longer exists. So this is just a case in point of why we stressed implementation. So it's about case management at courthouses and at jails to be able to swiftly link people to the services we invest in on a timeline and in a manner where the court can be informed and the judge can make a suitable order. And then even antecedent to that, it's also about judicial training, informing the judges of what's available, having judges have confidence in using community-based services when the slots are located, providing regular updates to all of the court players on mental health statistics in the jails and conditions at Rikers so that they understand what's at stake in making this choice between leaving someone at Rikers and sending them to resource we've invested in. So, philosophically, we're just trying to make the point that merely spending money on the problem is insufficient if we've not rigorously thought through and established the protocols around these implementation issues.
Thank you so much, Mike, for that very thorough answer. We hope that that answers your question for the person that dropped it in the chat. And I did want to open up this next question for everyone. And Stephanie, I could pull you in. I think you had flagged that you would like to answer this one. And it is, how can we get additional programs such as Harbor House, given their wait list is over 6 months out?
I would love other people to answer this question. I would just like to flag that part of the Treatment Court Expansion Act is that we are requesting $100 million for treatment providers, which does sound like a hefty chunk of change, I know, but the Treatment Court Expansion Act is going to save the state over $1 billion over the course of 5 years for in prison costs and $1 billion in jail costs. So that is why we are comfortable with making such a request.
Thank you, Stephanie. Would anybody else from the panelists would like to jump in?
All I can really do is acknowledge the question. It was among our recommendations to point out that we just have Harbor House as a residential facility, which has 59 beds for people with co-occurring disorders. And so I guess the answer to the question is that there's not an answer to the question. This is one of those areas where we're not even at the implementation stage we just talked about because we haven't made a sufficient investment in facilities that can serve people with co-occurring disorders, and we hope that happens over the next budget cycle.
That's
Yeah,
right.
I was
Go
just going
for it,
to
Yoda.
echo what Mike said. I think it's really going to be up to us to ensure that the new mayoral administration and the new city council, implements the recommendations of this report. And this would be one of those, is ensuring that there are additional harbor houses all across the 5 boroughs.
Thank you. And that's actually a really good segue to the next two questions that were asked by Doug. And so the first one is, will Mayor Mamdani invest in efforts to close Rikers during his term? And what are the factors that could limit his ability to shut down the jail? Additionally, he asked another one and says, why is it taking so long to close Rikers when the past 3, 4 mayors have spoken about it repeatedly?
I can go unless Yona, do you want to start on that?
You can go first, Mike. Go for it.
Yeah, so just to remind everyone watching, Mayor Mamdani has only been in office for 15 days. So it's hard to do too much in that span of time. However, he supports the closure of Rikers. When he was a candidate for mayor, he made very clear in interviews that he understands that significantly reducing the jail population is part of closing Rikers. So all we can do outside the administration is to try to be helpful to a new mayor who wants to achieve the goal, who understands at high level how to reach that goal by providing all the strategies that can help get to that point, some of which were in this report and others of which I tried to briefly allude to sort of in the opening slide discussing, like 5 other critical areas where we can and hopefully will develop strategies to reduce the jail population. Why are we, the other part of the question was, why is it taking so long when 3 to 4 mayors have spoken about it? Well, the plan to close Rikers originated during the de Blasio administration in 2017. Mayor de Blasio agreed to close Rikers, and experts, including in the Gutman Commission, where I served as a staff member in 2017, we always said this is a 10-year process. We need to build new borough-based jails. We need to shrink the jail population. And now we're delayed on that. And we could talk about, all of the bottlenecks of the Adams administration and not building the borough-based jails on schedule. Again, circling back to the earlier answer, I think we have a new mayor who wants to keep things on schedule. So we're late, but I should also make clear that the original plan, effective 2017, anticipated a 10-year process.
Yeah, no, thanks so much for that, Mike. And I think the only thing that I would add to that is it's really going to be incumbent to us and, groups that are on the ground, groups that are, organizing with directly impacted people to ensure that this new administration, this new city council, continues to fulfill its commitment to shut Rikers and, shows that commitment in this upcoming budget. Because I think this report outlines, in the 15 recommendations, many things that the city can be doing to reduce the jail population, to get people with mental health needs off of the island, which will advance the closure efforts.
Oh, I'm sorry. Melanie, can I quickly touch on the part of the question that I think neither of us got to? Yeah, what are the what could limit the mayor's ability to close Rikers? That's a very easy answer to the question. It is how effective we are in working with the judiciary. Because guess what? New York City government does not put anyone into jail. That happens at the courts, or for the fraction of people in jail on probation violations, it happens through the actions of, state parole violations happens through the actions of state parole. So the answer to that is that our failure to work effectively with, I think, a fairly forward-looking progressive court administration under Chief Judge Wilson is a key barrier. We must partner effectively with the court system.
Thank you so much, Mike and Yona. And with that, I'll bring it to some of the other questions that have popped up in the chat just now. One is from Jenny, and it says, under the Mental Health Parity Act, no one should be denied treatment. Shouldn't anyone who have mental illness or substance abuse or both MICA patients be under the civil justice system instead of the criminal justice system due to abnormal behavior? How can they take a plea/pause and are not in the correct mindset? Do we feel like we have an answer for that question, or would we like to save it for later?
It's a great question. I don't feel qualified to cover it. Um, I don't know if Stephanie, you do. Maybe it's one of those great questions none of us are ready to answer.
No, that's a fantastic question, and I would have to ask one of my colleagues who practices law. I am a policy attorney. But I would be
No.
happy to research that question and provide my email so that you can contact me and we can connect so that I can get you a legal answer to that, because that is a fantastic question and too complicated for me.
Absolutely, no worries. I agree. And so, Jenny, we'll make sure to connect with you offline so that we can get an answer to that question and have a deeper discussion about it. Appreciate you for dropping that in the chat. And I'm going to move on to the next question, which is you mentioned case managers. Is there a role for community health workers with lived experiences or other credible messengers?
Absolutely.
Oh,
Yeah.
Stephanie,
Oh, no,
yeah,
please, Mike,
please.
go ahead.
No, go ahead. Go ahead, please.
I was just going to say the Treatment Court Expansion Act specifically has peers enshrined in the law, as we have peers at every juncture being included in part of the bill that they are to be included in the process. So we recognize that lived experience is so incredibly important and valuable. There are peers who work in my office who help people throughout the process. And so a resounding yes. So sorry, Mike, go ahead, please.
Going to say exactly the same thing. I would hope so. I should plug there is an experiment going on now with supervised release programs and providing sort of community-based supervised release locations. I believe people with lived experience are involved, and otherwise agree with your answer, Stephanie.
Thank you. And Stephanie, I wanted to ask a follow-up question that was dropped, and it is, how would the Treatment Court Expansion Act address the rising rates of serious mental illness at Rikers Island specifically?
Yes, so that's a great question. So um, it would recognize throughout the state, it would address the serious rates of mental illness. But what would happen is people would be considered for mental health with mental health concerns right now who are not necessarily being considered in certain treatment courts because of their specific charge, who have serious mental health concerns. And people who also who are in various states of what's happening now is that was mentioned is there's a rising number of people with serious mental health illness. The number has gone up over the years, even as the population oscillates, the number of people with serious mental illness is going up. And so what the Treatment Court Expansion Act would do is it would allow people to be considered who have maybe would right now a prosecutor would decline them on the basis of they have a certain felony conviction that might not be looked at, or they have other issues that have precluded them in the past. And so all of that would go to expanding access and providing people on Rikers Island specifically into mental health court. Um, Between Queens, for example, and Manhattan, there's just completely different data in terms of who is getting off Rikers Island, and that disparity needs to change.
Thank you so much. And we also have a follow-up question, Stephanie, and it is, how can we assure that the Treatment Expansion Court Act doesn't further the harms of AOT?
Yeah, I saw Jordan put that in the chat. Shout out to Jordan, who's a former colleague of mine. It would not further uh, assisted outpatient treatment. We would not they make sure working, sorry for the background noise in my office, that would not further the harms of AOT. That's a very important for our coalition and the people that we did consultations with over the course of this bill, in making sure that we were not pursuing anything that would be coercive or in any sort of manner whatsoever. Our intention is to have as much of a outpatient treatment as possible, getting people the least restrictive treatment as possible. But we are open to conversations around how to make sure implementation, and that is an important word, implementation, that the rollout is such that it's a reflection of that, and that the principle is carried out, that that um, that as much as possible, this bill is adhering true to that principle. But there are pieces in the statutory language that ensure that that is the case, that is not putting people in any kind of position where they're going to be um, further harmed.
Thank you, Stephanie, for clarifying that. And I know we're getting close to time, so we have enough time for one or two questions. And I did want to make sure that we turn it back to what can folks do who are in this call to take action and use this report to advance the key findings of it. And first off, I did want to bring you back, Stephanie, to just share with folks once again how they can get involved to pass the Treatment Core Expansion Act one more time before we move on to a final question.
Yeah, absolutely. So we would love for you to join the coalition, which you can simply by emailing me, and I'm happy to distribute my email. And we would be love for you to come up and join us in Albany on the campaign on January 20th. We There is an advocacy day where we visit with legislators. I don't know if you've had that experience in Albany. It's a very interesting one, meeting with different legislators, but you also come together in this collective community that's really beautiful. Um, and there's also an action where you can just take a quick action, 3 seconds today, and you can tell your legislator about this bill. And those are all, I believe, in the chat. Sarah has been so kind to share that. And I just want to thank the Data Collaborative and Katal for sharing this space with this coalition. I just am really, really grateful to you all for allowing us to speak and take up as much space as we have. It's so kind of you.
No, thank you, Stephanie, for all the work, and we're right there with you. And I also want to uplift Sarah for dropping all of the links in the chat. Make sure that you're keeping those links and saving them. Now, this is a final question for all of the panelists, and it is, how can folks on this call leverage this report to move elected officials from acknowledgement to action?
I can speak for the Data Collaborative for Justice. As I said at the outset, the Data Collaborative for Justice has mass incarceration among the areas we work in. And then in turn, most of our work on that area is the jail population. So, for us, everything in this report goes into our own organizational list of jail reduction strategies that we've been talking about from our end for years. And our hopes are to keep engaging with people who are on this call, hopefully with the Mayor's Office of Criminal Justice, which addresses one of the other questions. Yes, and in response to another question in the chat, this report has been shared with MOCJ, and our goal is to just keep engaging all of the players on our list of jail reduction strategies that we would love to see happen.
Thank you, Mike. And Yona, I'll pass it over to you now to bring it home.
Yeah, no, thanks so much, Melanie, and thanks so much, Mike, for that kind of great wrap up. And in the next slide, all of our emails will be posted up. So one thing that you can definitely do if you want to get involved with Katal and our Shut Rikers campaign, feel free to reach out to myself or Melanie, and we'd love to get you involved and connect with the campaign. And one thing that we will be doing is meeting with different city and state elected officials talking about this report. And so if you want to join any of those, if you want to do a constituent meeting yourself, we'd be happy to help set that up. And so just to wrap this up, first, I just want to thank all of our panelists and everyone who showed up to understand more about the report on mental health and Rikers. This was a really fantastic webinar. And like we said, we couldn't get to all of the really amazing questions, so we'll definitely be following up with folks. And thanks for some of the really, really insightful questions about how we can really reduce the jail population, get people with mental health the services they need, and get Rikers out and closed once and for all. And then just a couple other housekeeping. Don't forget to save the link to this event webpage. We'll share the recording, we'll share materials in the coming days. And so definitely save this link. And then also we have a survey. So please let us know what you thought about today's webinar. And we'll post the survey link in the chat right now. And that's it. So thank you all so much for joining. We said we'd try to get you out by 2 p.m. and we're going to keep our word, which is great. We love to end meetings on time. Yeah, so thanks so much for joining and be on the lookout for more resources and a follow-up email in the next couple of days. Thanks so much, everyone.